Megan, we've both been hearing from lots of people that they're finding it refreshing that we're talking about social media and mental health in a new way. So what are some of the reasons you talk about it differently, and how do you approach it?
Well, I think whenever I'm having a conversation with a teen and their family in a clinical setting, I'm always thinking about centering on the teen and the health of the teen. And I think that our new narrative has really shifted the way that we talk about media to focus more on teens and less on some of the kind of fear-based framing that we've heard in the past. What do you think?
What I have heard for years is that anything that's highlighting the risks of screen time, that are making it sound like this is scary and new and parents don't know what to do about it, it makes parents feel a bit frozen. They kind of feel really guilty. They're not really sure what to do. And so one of the main things I brought to the Center of Excellence is to try to shift the framing to more solution-oriented, building on the strengths that families already have that they bring to their parenting. And then to be super pragmatic about it. You know, what are some things you can try? You're not going to understand all of these new technologies that are being introduced, every day. But if you have a little bit of language about how to approach your child about this, how to have some collaborative problem solving around it, and to know the basic features of the tech that they're going to be using, parents will feel a much more positive mindset about this problem and less avoidant or controlling of it.
I totally agree. And I think that that's really great for the kids or the teens that are involved as well, because they can get a sense that their parents or their caregivers are willing to engage and willing to answer their questions and have dialogue about this topic. I think that the narrative we're really trying to promote is also to recognize that kids have different needs and have different skill sets they bring to their technology use by different ages and developmental stages, and that making some mistakes along the way is common and expected, just like learning a new sport. So we really want to encourage that dialogue and that willingness to engage and learn together between parents and kids.
Completely. And I think one of the reasons it's so important is, number one, every child is wired differently. I'm a developmental behavioral pediatrician. You're an adolescent medicine physician. We both know every child and every way the parent responds to them is really unique. And they're all going to have unique relationships with media. So if we can really focus on who is this kid? What are they going through? What are they great at? What are they struggling with? What are some of the ways those strengths and challenges might interact in good ways or bad ways with different social media platforms or technologies? I think that's the broader curiosity we want to inspire in families. Of course, we want to have some practical tips also about how to make this work for your family. But I think that families will feel more ready to try to do this experience together with their kids if they have that more open and curious mindset.
I totally agree. And I think that one metaphor that we've used sometimes in the center is that learning to use technology, especially social media, can be a lot like learning to drive, where we really want there to be a lot of interaction between the teacher and the learner in the beginning phases, but then allowing some independence over time as that child grows and develops, and understanding that their use of technology and social media won't be the same when they're 10 and when they're 15.
And I think from an early childhood perspective, also about the metaphor of teaching your kid to swim, because that takes years. And you kind of start out with a bit more monitoring, more hands-on, more teaching, and eventually kids become more independent. But at the same time, if you live near a lake or an ocean, the waters are changing constantly too. So you may have to have more monitoring or more specific skills that you're teaching at some time when the waters are rough or others. And I think back to your point about wanting to keep things open so kids will come to us, because media right now is not the same thing as you have a TV in your living room and you're all sitting around watching it and you kind of know what your kid's seeing. With handheld devices and really personalized feeds and ads, kids may be seeing things that you just, as a parent, you can't monitor everything. And so we really want to keep the lines of communication open so that kids can trust that they can come to us. We're not going to freak out or overreact. We're not going to take everything away and shut it down, but that we're here to listen. If there is something like someone being mean online, seeing some creepy content, not being sure what to do, if they're not having as good of a time on their social platform as they had hoped.
I really love that. And I think that a big piece of that runs through these metaphors is that parents don't have to be Olympic swimmers to teach their kids to swim, and they don't have to be Indy 500 drivers to teach their kid to drive. But it's really having parents be in the role of teacher and caretaker and being there to help that child navigate their curiosity and their enthusiasm for this new thing that they're learning. And so I think that brings us back to thinking about centering on the kid and what the kid's needs are and allowing those questions and that curiosity to come forward. So let's talk a little bit about the intersection of child health and schools and how that intersects as well with social media and technology use. I'll say as an adolescent medicine physician, we have seen a real increase in mental health concerns among our patients, which really peaked during the pandemic. I can share in our adolescent medicine clinic alone, our numbers doubled to tripled, and we're seeing data from around the country that many other adolescent and mental health services just saw such an increased demand. We know that teens are struggling with depression, with anxiety, with disruption of patterns in their relationship building and development due to the pandemic. And we're seeing that come out in so many different ways at school, at home, and even in our clinics. What are you seeing among younger kids?
So I'm a developmental behavioral pediatrician, and I work with kids who have autism, ADHD, learning differences. So we really see when kids are struggling in the school setting, we often hear about it from families, and that has definitely risen since the pandemic and virtual schooling, as well as the return to the classroom. Kids were under a lot of stress from so many different factors, including financial and socioeconomic factors. Their parents are under a lot of stress. There's just been a lot more societal stress and polarized arguments. And I think that kids absorb that. That is natural, that they are kind of watching the world around them and saying, am I safe? And so one of the ways that kids react when they're not feeling safe or they're not feeling understood is either with shutting down or big behaviors. When they show big behaviors in the classroom, that can lead to disciplinary action or suspension. And a lot of teachers have expressed to us that they're seeing kids feel a lot more dysregulated, not having as strong social skills or problem-solving skills, and that this has been kind of across from all the way from preschool up to the high school years. So it's natural for us to wonder what role technology is playing because kids had so much more technology use during the pandemic. We know some of it was pretty positive, that they were connecting with family members or they were watching educational programming, but some of it was not as productive, or research has shown has led to heavier media habits even after pandemic restrictions were lifted. So kids just got in the habit of using videos more, video games, their phones or social media. Now, when it comes to the intersection of social media and mental health in middle schoolers and high schoolers, what are the biggest things you see or that you would want teachers to be aware of?
I think that one pattern we see is that there isn't an absolute pattern that every kid is experiencing, which is so true about child development in general. But I think we see everything from teens who really want to keep their phone close and engage in checking behaviors and anxiety-driven behaviors. Are their parents okay? Is there going to be another shutdown? Is there going to be violence? We also see kids who have a hard time self-regulating and wanting to use their phone to calm themselves or to distract themselves. And so those behaviors can be interpreted in many different ways, but a lot of it has roots in struggling with their own well-being.
What I love about the way you describe that, and that we're really trying to focus on at our Center of Excellence on social media and youth mental health, is that you're wondering about the child's motivations for using their phone or being on technology. What is it about their emotional state that is driving a behavior? Because when you're a parent or teacher, all you're seeing is the behavior. You're seeing, oh, they're checking their phone again, or they're just obsessed with it, or they're withdrawing from me and they're just on their phone. But really, to support youth mental health, we need to wonder about what's going on in that child's mind. I know that's hard for busy teachers and administrators to do on a child-by-child level. But I wonder also if there's things that can be done in the classroom to help kids reflect on their emotional relationship with technology. What is it that's driving me to my phone? Is that helping? Or did it just distract me and now I feel more lost or disorganized? And what are the places that kids are seeking out online that actually give them really positive, affirming experiences? And which are the ones that sometimes are great, but sometimes feel like a waste of time? So, how can we as adults try to think more about what this behavior means when we do see it, say, in school?
I think building on what you said, I think centering on the kid and where the kid's head is at that moment. And I think educators are so uniquely skilled in managing large groups of kids, whereas we as providers have the luxury of usually one patient at a time. But I think that centering on where is that kid and what's behind that behavior. And we have seen cases where some educators are in some types of groups or organizations or sports teams, there'll be an open conversation about what are our standards of behavior and how do we want to have some shared community guidelines for how we're going to use or not use these tools. So acknowledging that if the phone's there, there's going to be a compulsion possibly for some kids to reach for it. Not saying that it's all bad or all good, but establishing some community guidelines in some cases can be helpful. But every classroom and every culture within that classroom is different. So this is a unique challenge for educators.
Yeah, we recently did a study tracking 11 to 17-year-olds' phones over the course of a week and found that lots of them picked up their phone at least once during their school day, which makes sense. But some kids were spending hours on their phone during a typical school day. And we interviewed high schoolers to ask them, tell us about this. What does this mean? Why are kids on their phone in school? The usual reason was, for my friends, we need to coordinate. I want to keep in touch with them. Kids, it's developmentally normal and adaptive for teenagers.
Just like we used to pass notes.
Exactly. To want that connection in the middle of your day. It's thrilling, it's fun, it's affirming who you are and who your peer group is. They also told us, though, that sometimes it can be a procrastination or an escape technique if school's feeling like too much. It's like, well, let me just go get a break and look at some TikTok or play a video game because it calms my brain down. One kid said it resets me a little bit. So that's an important idea for schools is, do you have other ways that kids reset when they're feeling overwhelmed and they can regulate? Another thing kids told us is notifications are a lot also. And many of them have strategies for turning off notifications or filtering who notifications are from. But that could be something that classrooms could do too. If you do allow kids to have their phones, having ways to set do not disturb or turning off unnecessary notifications. And if you're a teacher who uses a technique like everyone puts their phone in a bag at the front of the classroom or there are stricter rules, still use that as an experiential learning opportunity. Like for kids, how did that feel to be away from your phone? Did you get used to it over time? Did you feel anxious about it and why? I think that these are nice teachable moments. Of course, if you're a teacher who has the bandwidth to think about it, but there are curricula available to give teachers the words and tools to talk about these topics.
One thing I really love about the work we're able to do in the Center of Excellence is that I feel like for so long, pediatricians have been trying to solve many of these issues in our silo, and educators in their silo, and coaches or other folks who are so important in the lives of kids are solving in their silo. And I think we have the opportunity to try to really bring in questions and problem solve together and try to come up with some approaches that are so child-centered, but can apply to all these really important groups in kids' lives.
Yeah, as we've started this work with the center, I've gotten more and more questions from educators, especially early ed or elementary school age, saying, help us figure out how to talk to families about tech use, because it's such a tricky topic. Parents feel judged really easily, or parents are judging the amount of tech that's used in the classroom. And it can just be too hot of a topic where people don't know how to communicate about it. So that is something we're paying a lot of attention to. And I hope that the center is able to both give educators some language and maybe some tip sheets, maybe some other things to send home to say, here's how we do this in the classroom, how we're trying to teach kids to have healthy relationships with technology. And here's some ways you can carry that forward at home. Instead of just feeling like we're judging families for, well, your kids are on media too much at home, or I would love for it to be more problem solving and strengths-based language that's saying, like, we know sleep is so important. Here are some tips to make, the balance between technology and sleep a little bit easier for kids who are struggling in school.